Okay, I think we'll begin. Good evening, everyone. I'm Jeff Simons. I'm the Superintendent of Schools for the East Greenbush School District. And we thought it would be a good idea to check in with our community, our parents, and the greater East Greenbush community as we enter into the holidays and we move through various responses to the situation regarding COVID-19. The format for this evening's meeting will be very similar to what we did in the spring during the period of school closures from March through June, and also some of the forums that we held regarding the reopening in August in anticipation of the new school year. I first and foremost want to welcome the members of the administrative team as well as our panel, including some outside guests who will help respond to your questions and concerns throughout the evening's meeting. First, we have Mike Buno, who is our Board of Education President and a parent in the district. We have Dr. Kevin Albert. Dr. Albert has been very helpful to our district in terms of developing our plans to react and respond to COVID-19. He is the district's medical director. Jim McHugh is our Assistant Superintendent for Curriculum Instruction and responsible for the oversight of the instructional program, K through 12. Karen Vincent is a registered nurse and was hired by the district to serve as our COVID-19 coordinator. And she has been very busy, as you might imagine, since she started in October working for our district. Marissa Cannon is the Director of Human Resources, oversees all of our hiring, recruitment, and issues related to employee welfare during this time. Ms. Jill Barker is our principal at Goff Middle School. Mr. Jack Alvey is the principal at Donald P. Sutherland Elementary. Mr. Mike Harkin is the Columbia High School principal. Mr. Dan Garib is the elementary school principal at Green Meadow Elementary. Ms. Molly McGrath is the Director of Pupil Personnel Services, who oversees special education related services and our nursing program. Ms. Linda Wager is our Director of Business and Finance, who oversees the district's fiscal operations. And we are joined by Craig Hansen. Craig Hansen is the Director of Health, Safety, and Risk Management Services at the Questar 3 BOCES. Craig has been in an instrumental role serving as a liaison between our school districts and the Rensselaer County Department of Health, as well as helping to support 23 school districts who are currently implementing plans to educate and respond to COVID-19. I am assisted in this meeting by Mark Adam, who is our public information specialist. The newsletters, the announcements, and all of the stories that you receive via school messenger, as well as our website, is overseen by Mr. Adam, and behind the scenes is Mr. Goodwin, hopefully making this meeting operate effectively for both us and for you. We're glad that you joined us this evening. We recognize that this is both a busy time and an uncertain time for everybody, and we wanted an opportunity to check in with everyone to let you know what we do know about the current situation with COVID-19, how the district will be approaching various decisions, to provide some information about some recent changes that we made to address and respond to increased cases of COVID-19 and how those cases are impacting our district. So I'm going to spend approximately 20 to 25 minutes, and I hope to be finished with a presentation portion of the meeting by 7:30, and then we will engage all of you in a thought exchange process, which will help us to better understand the priorities and concerns of our community as we continue to move our great district forward. So if you give me just a minute to share my screen. I want to make sure that everyone can see this. So I bring it over. I'm going to ask the members of my administrative team to give me a thumbs up if they can see the presentation. Very good. Hopefully the members of the public can see it as well. So here we are on December 21st. close to the mid-year point within our school calendar. And the situation from the time we reopened our schools under New York State Department of Health guidelines and New York State Education Department guidelines, the situation continues to change daily. And we want to make sure that our public is kept informed of the changes and how the district will respond to them. So this is really a community check-in to share information and also to provide you with updates regarding the district's decision-making. And we want to be able to respond as effectively as we can to your key questions and concerns. While we do experience some challenges right now, hardships for our families and our students, and some challenges in which our staff is meeting these challenges on a daily basis, we want to begin by reflecting on what we've accomplished really since the summer. Through our reopening plan and working with various stakeholders, we are continuing to offer a full level of courses at the middle school and high school. The program of studies that was in place prior to COVID, the elective courses, the AP courses, the honors courses, those courses that are both college preparatory, but also enable kids to earn college credit, all of the courses that the community expects from the district continue to be offered. And as we have moved into the school year, we started by offering full-time summer school for our students with disabilities who qualify for year-round programming. And we've tailored our program to be able to adjust and to provide as much in-person learning and delivery of services as feasible within our hybrid model. And we have reviewed IEPs and programs to ensure that students in special education whose families have opted for the full remote option continue to be served well. And over the course of the last several months, as we opened in September, while we have announced a number of cases of COVID-19 among students and staff within our school district, based on the contact tracing that we do through the work of our COVID coordinator, our administrative team, and in coordination with the Department of Health, we can confidently say that we've had 0 cases of COVID spread within our schools. In each case in which we've had students and staff contract COVID-19, based on the contact tracing, that infection has been spread through activities that have occurred outside of the school. Additionally, based on the administrative team's request, the board agreed to purchase additional technology, including personal devices, to enhance the virtual learning program for our students and families. We were very nervous, and Dr. Albert was part of this discussion, about starting fall sports. And we were able to offer in the fall moderate to low risk sports. And I'm happy to report that it was a very successful experience for our students and for our coaches. And we had no issues of infection spread within any of our sports, due in part to the great job of our athletic director, Mike Leonard, all of our coaches that coach in the fall sports season, and the cooperation and support of our student athletes and our parents. And based on state extensions of requirements, we continue to provide meals to students where necessary, and we will continue to do that through June 30th. So as we reflect on some of the challenges we're experiencing currently and the adjustments that we need to make, we want to go back and make sure that everyone understands we've had a very successful fall. Based on our timeline, we made an adjustment to the school calendar to move the start of the school year for our students to September 14th. And while that did have an impact on the overall availability of snow days for our students, and we understand that that adjustment has come with some concern, that change did make us able to ensure that from a health and safety standpoint, and also from a standpoint of being able to deliver remote and virtual instruction, the additional planning time that contributed to our success in the fall. In September, Due to an issue that occurred before school started, we recognized that a number of our students need to take the SATs. And so we offered the SATs in the summer. And it was reported to us by the New York State Department of Health that our first case among a student that we would experience was involved with a student who attended the SATs. Fortunately, due to the procedures that were in place, health and safety procedures, as well as seating charts, students wearing masks, and socially distanced and separated into various locations, those procedures served us well, in which no one who attended the SATs contracted COVID-19, either a student or a parent. However, we did make the cautious decision to not sponsor additional SAT events at our high school. On October 22nd, we were able to hire Karen as our COVID coordinator. It was soon after we hired Karen that the number of cases among students and among staff began to increase. So we were fortunate to have an RN dedicated full-time to this work to ease concerns of students, ease concerns of the parents, and to make sure that we were able to do the contact tracing effectively. In November, we learned that the January Regents exams were canceled by the New York State Education Department. At this point, we have not heard whether a decision has been made regarding the June Regents. So we are moving forward with an assumption that those exams will take place in terms of making sure that our curriculum is aligned with expectations for our high school students, as well as our accelerated students who take a Regents exam at the middle school level. In the event that those exams are canceled or adjusted in any manner, we will make sure that we inform the community. And on Friday, we made the very difficult decision, after monitoring what was happening in terms of the number of staff members and students who were unable to come in person to school based on such factors as quarantines from the Department of Health, people who were awaiting test results who are not permitted to be in school until those test results come back negative, and other COVID-related issues. We made the very difficult decision to shift to a virtual model through this week. One of the primary factors in that decision involved the fact that the infection rate has increased significantly within all counties in New York State, including our own, and the effect of that infection rate increase is we are experiencing a number of students and employees who are quarantined and are not permitted to be within our school facilities. That affects the district's ability to be able to operate both safely and to be able to deliver the in-person instructional program effectively. Just since October, at the time when we were considering increasing the number of days that our students in kindergarten attended in person, we understand the strong concerns from our elementary parents about the need and the value of in-person learning, as well as the impact of the current hybrid on families, with parents having to work, with parents also concerned about the development of their children academically and socially, emotionally. However, the infection rate has gone from 1.3% 7-day rolling average in Rensselaer County back in late October and early November to its current infection rate of 7.2%. So just in a short period of a few weeks, the circumstances that the district needs to respond to and the impact of community spread on our schools is significantly different than it was at the time when we were considering bringing more kids back for in-person learning. And so we've had to shift directions. The increases in the infection rates, while we report to our community this evening, and we have reported in the past that there is no evidence, in fact, very limited evidence across the state that schools are the source of spread for COVID-19, And there have been 0 instances of COVID-19 spreading within our schools due to the good job that everyone is doing, including our students, our families, our staff, and our administration. The increases in the infection rates contribute to increases in students and staff cases to the point now where typically either every other day or in some cases every day we are announcing a new case. This has resulted in an increase in the number of both staff members and students who are subject to quarantine. In most cases, the quarantine lasts for 14 days. And on Friday, when we made the difficult decision to make the shift to virtual learning, which really have impacted 1 day of the 3-day schedule this week, it has made it difficult to ensure that we have an appropriate number of substitutes and number of staff that we need to be able to support our schools through in-person learning. So the increase in the number of quarantines of staff members contributes to staff shortages. And since Thanksgiving, we've had a couple of things happening. Families have contacted us and asked us if it was all right if their child stayed out of school for in-person learning and participated remotely for a short period of time. And we have tried to be sensitive to the fact that our families are concerned in granting that ability to participate virtually. It has also affected the balance of instruction in some of our classes, whereby in many cases, there could on any given day be more students participating in a classroom experience virtually than are actually sitting physically in the class. And that has implications for the teaching and learning environment. Our teachers want to be able to respond to the individual concerns of students. They want to be able to prepare and plan to make sure that they're addressing the needs of both the students that are participating in person and also the needs of those students that are participating virtually. And that's becoming more challenging as the number of students participating remotely has increased and the number of students attending in person has decreased over the course of the last several weeks since Thanksgiving. So we have had staff shortages in all buildings. We've seen an increase in absences due to quarantines and individuals who are awaiting test results. We have also seen that in some classes, we're unable to cover those classes with certified teachers or available substitutes. We have limited availability for substitute bus drivers and support staff. And we all share, every building shares in the same substitute pool. So I've heard over the weekend from some families and saying, well, my elementary school is doing a great job. And that's true, all the schools are doing a great job. We've also heard from our families who've said, well, if we're doing a good job and we have very few, if any, cases of spread within the schools, why are you shifting to virtual? It's because of the impact of the quarantining on employees being able to come into school to provide in-person support for the kids. And we had a conversation last week about trying to do what we could as a school district to prevent students, staff members, and families from being impacted over the holidays by being quarantined. And so we wanted to do what we could in the short term to reduce the chances that that would occur, as we have been seeing this trend getting more concerning on a daily basis, really since Thanksgiving. So as of Friday, and these numbers change daily because we have students and staff members who are quarantined, and after 14 days, in most cases, the students, and in most cases, the staff, do not become infected with positive results for COVID-19. However, if you look at the list, we had well over 100 students who were quarantined as of Friday from the high school. At Goff Middle School, we had 16 students. So in total, we had a number of students who are quarantined and which is affecting instruction. And as a percentage of the enrollment, we had about 8% of our students at Columbia High School on quarantine as of Friday. In terms of our employees, and again, we share the same resources. We share the same pool of non-instructional and instructional substitutes. We had a number of employees who were quarantined, and as a percentage of the overall number of employees within each building, it varies. However, when you look at the totality of the impact of the students who are on quarantine and the employees who are quarantined, it has a significant impact on our ability to operate and offer in-person learning. We have shared this information in the past, but I think it's important as we've engaged in contact tracing for people to understand that just because you come in contact with somebody who came in contact with somebody else who has COVID-19, it does not mean that you will become infected. In fact, we label the person who was infected with a confirmed case as person A. That individual, once we've been notified that the person is positive for COVID-19, they are not permitted to be in our schools. Anyone who came into contact with person A, whether that be a student or a staff member, is required to be on a mandatory quarantine up to a period of 14 days with some exceptions. So how do we go about doing that? We look at a individual student's last date at which that student was in school. Okay? And under contact tracing rules by the New York State Department of Health and the CDC, we look at the date at which a person became symptomatic and we go back 48 hours. And in some cases, because of the hybrid model that we are operating, we have found that because students who attend on A days, which are Mondays and Thursdays, that if an individual student starts to become symptomatic on a Friday, that 48-hour rule has really helped us reduce the likelihood of spread within the schools. We would go back from a student who indicates symptoms on a Friday to a Wednesday. Well, we have virtual Wednesdays, and no students are in our school and would be in contact with any other students or staff member on a Wednesday. So there's more than 48 hours between each student's in-person day under our hybrid model, and that has really helped us to make sure that we are reducing the likelihood of spread within the schools. And person C is anybody who was in the school but may not have come in contact with the case and may have come in contact with somebody else who's a contact, but that person doesn't need to quarantine. So under contact tracing, our district is informed of a positive case. We are often informed by a parent before we learned about it from the Department of Health. Our COVID-19 coordinator, Karen, and our school administrators begin the contact tracing process immediately. In fact, we were doing it this afternoon. We were doing it yesterday on Sunday afternoon, and pretty much every night and on the weekends, we are doing it now because of the rising number of infection rates within our county. We look at the attendance record. When was the last day that the individual was either at work or in school? We look at the class list. Who else was in the class? And at the high school and in the middle school, it's different than it is at the elementary school because you have multiple classes for which we need to contact trace. We look at the proximity of kids to other kids, to the child who had the case. We look at seating charts. We update those seating charts on a regular basis. We look at the bus routes and the number of students that happen to be on that bus with the student who has been identified as a positive case. And we've even gone to the step in our middle school, as we've dealt with some cases among employees, to look at the surveillance cameras that are available to see where did individuals go. Because when you are under stress, you find out that you are positive for COVID-19. We are finding that individuals' recollections are not always accurate. And we interview the employee, we interview the teachers, we find out what was going on in the classroom, and we talk to the student and we talk to the family in some cases. But it's the date at which the symptoms first began to show. So if someone begins to have a headache on a Saturday, 48 hours prior to that, we have to go back to Thursday. We have to look at the last date of school attendance. We communicate with Rensselaer County Department of Health, and we contact the impacted families, and we notify the community. As the rate of infection in our state has increased in September, For the period of September through November, the governor has been announcing almost on an every other day basis different steps that the state is taking to address the increase in COVID-19. Through that information, the state health department has determined that almost 74% of the cases that have occurred since September through Thanksgiving and post-Thanksgiving into the holidays are associated with small social gatherings within the household, what is commonly being referred to now as living room spread. He has also reported and changed the rules that schools must operate on because the schools are doing a good job and the infection rate is relatively low within our schools. In fact, given the number of cases that have occurred, 46,000 data points since September, the percentage of high school student to other high school student or staff member spread is 0.46%. In the case of an elementary school, it's 0.49. In the case of a middle school student, it is much lower. So the schools continue to be a safe place. In fact, the governor has said one of the safest places to be. However, the impact of the increases in COVID cases is affecting our ability to be able to staff our schools, and the quarantining is impacting our employees, it's impacting the district, it's impacting our families and our students. New York State has announced that various geographic areas based on indicators regarding COVID-19 could be placed in the yellow, orange, or a red zone. Those classification and the criteria have changed over the course of the last several weeks as more information has been learned about the spread and the fact that schools have generally done a very good job with managing all of this. East Greenbush Central School District and Rensselaer County are currently not in any of these zones. However, we are preparing to be able to continue to be open to offer in-person learning in the event that we are subject to the requirements of the New York State Micro-Cluster Strategy. If we are placed in a yellow zone, we are working with Questar 3 BOCES, and Craig Hansen is on this meeting with us. And Craig reported to us over the weekend that Questar 3 BOCES has been approved as a limited service laboratory and will be able to help our school districts implement testing. We will be required to test 20% of all of our employees and our students who are participating in schooling in-person learning. We are in the process of discussing this with our school nurses and training our school nurses in the rapid testing process, and you should be receiving from us a parent consent form very shortly in the event that we have to implement testing in order to stay open. We continue to communicate and collaborate with our families. We will continue to notify you regarding positive cases. We are working to provide resources and services within the community. 2 to 3 days a week, all of the superintendents in the Questar BOCES region, which includes Rensselaer, Greene, and Columbia counties, collaborate. Once a week, we meet with the Rensselaer County Department of Health, and those meetings are facilitated by Craig Hansen, our Director of Risk Management, Health and Safety Services, and we continue to keep the public informed through our Board of Education live streamed meetings. As we move forward, and this is very important information, the decision that we made on Friday was based on where we were at regarding the quarantining of our faculty, our non-instructional staff, and our students. That decision impacted families. We understand that. And that was a short-term decision to get us to the Christmas and the holiday recess. The district is planning to resume the hybrid model for all students on January 4th. However, since August, we have communicated with the public that it may be necessary at any time to shift from our current hybrid model to a full virtual or remote model. That circumstance is more probable now than it has been since September. So families need to be prepared in the event that we gauge the circumstances regarding how COVID-19 is impacting our students and our staff, and that we have to make a continuation of virtual learning as we come back to school in January. Everyone should have arrangements. As difficult as that is, everybody needs to have an arrangement. Any changes will be communicated through an announcement that we will make no later than Wednesday, December 30th. If increased cases are impacting our school's instruction, if we don't think we will have sufficient staff, and the bus drivers are a big factor here, we will prioritize the K-5 for in-person learning. We will strive to maintain the current hybrid of 2 days in-person learning, virtual Wednesday, and remote days for our kindergarten through 5th grade, unless we don't have sufficient bus drivers to get the kids to school. We will go virtual for the week of January 4th through the 8th at the high school and Goff if necessary. This is our backup plan. Again, I reiterate, we're hoping to be able to have the hybrid in place for K-12 in January, but this is our backup plan. We will make, in the event that we have to move to this model, K-5 will be prioritized. We will go virtual with the high school and the middle school in the same format and under the same schedule that we're doing this week. And we will continue to assess the situation and make a further assessment about where we will go by the end of that week, Thursday, January 7th. And again, all families should have a backup plan in the event that virtual learning is extended. We are continuing to prepare for the testing program. We are monitoring the infection rates more than once daily. And we are continuing to report cases and quarantines, which is continually shifting. We have more cases today that have not yet been announced and will be announced this evening. Employees are communicated with, and we've had faculty meetings at both the elementary, middle school, and high school level over the last few days. And we're asking our employees to contact us and let us know if in some circumstances over the holidays, they become positive for COVID-19 or if they are subject to a quarantine. This is happening much more frequently than you might imagine through outside activities and other things that are going on within the community. And should anybody have any questions about a positive case, a quarantine order, they can contact Rensselaer County Department of Health. We ask everyone to consult with their primary care provider, or they can contact Karen Vincent, our district COVID-19 coordinator, at the email as provided, or you can contact me. We want to be accessible, available, and supportive of our families, of our employees, and of our students. Additionally, we are encouraging everyone to continue to follow New York State Department of Health and CDC guidelines. This is critical, as again, we've gone from 1.3% 7-day rolling average infection rate to 7.2 in just a few weeks. We ask everyone to carefully consider your potential holiday plans and to reduce the risk as much as possible. Starting around Halloween, we began to hear from our state that Halloween gatherings were going to become a concern and contribute to potential spread of COVID-19. After Halloween, the number of cases that the district had to deal with increased. We continued to hear that there was a concern regarding Thanksgiving, and Thanksgiving plans should be modified to include only those members of the family that live within the same household, or cases will go up. We saw the cases go up dramatically after Thanksgiving. Additionally, we are continuing to hear that people should consider limiting their holiday plans, and nobody, including me, wants to do that. However, in the interest of everybody, I think we need to do it. I'm encouraging everybody to make sure that you understand that although the infection rate is very, very low in school districts, the schools, the students, the staff, our ability to offer in-person learning is affected by what happens outside the school. And if the state is saying 74% of the cases are coming from living room spread, And if Halloween and Thanksgiving is any indicator, we are going to experience rising cases of COVID-19 soon after the holidays, and likely between a 2-week period after Christmas. I'm hoping that that does not occur, but everybody has to be mindful that it could, and we need to work together to follow these guidelines. So at this point, I'm going to stop sharing the presentation. I appreciate everyone's patience. I went a little bit longer. And I'm going to try to share I need to make Mr. Adam a co-host. Peter, can we do that?
I think I'm actually already a co-host, Mr.
Okay.
Simons.
And we're going to begin the thought exchange.
Thank you, Mr. Simons. So I'm going to share my screen now. Does everyone see the thought exchange screen with the purple bar? All right. So we're going to be using Thought Exchange here. It's our crowdsourcing platform to direct the Q&A this evening. You can join by visiting tejoin.com and then typing in that 9-digit code you see on your screen. And the question is, what are your key concerns and questions at this point of the school year? So I'll leave this screen up here for a minute so you can join. Once you're in there, you'll have an opportunity to ask a question or share a concern. And then at the next stage, you can rank the questions and concerns of others. So again, just go to tejoin.com and then type in the 9-digit code you see on your screen. And the question is, what are your key concerns and questions at this point of the school year? So I'll start the timer.
Okay, as we're doing this, I'm told we have about 100 people on the meeting now.
So again, once you join, you can ask your question or your concern, and then go on to rank the questions and concerns of other people. Try and use the full scale of 1 through 5, whether you agree or disagree, and that'll give us the best results to go off of and answer the most top of mind questions. We'll try and do a few different thought exchanges throughout the course of this meeting, so this will be the first one. All right, time is up, but you can continue to interact with the thought exchange, and we'll get started with answering some questions. So first up, will the district consider adding an additional in-person day for K-5 on Wednesday?
So I'll start with addressing that, and then I'm going to pass it on to Mr. McHugh. We did start to consider that option in October. There were some concerns expressed to us from some of our families regarding the virtual Wednesday experience. We did a survey of both teachers and parents to see what might be done to improve that experience. We also looked at the option of having a schedule which permitted students to come for in-person learning on a Wednesday every other week. As we were engaging in that process, we're also looking at what we could do to increase kindergarten 5 days per week, and we had plans to be able to implement that, and the infection rate continued to increase to a point that we didn't think that was feasible. We will consider that option, hopefully, as the cases, as projected by the governor, should be better after January. It's important for the families to understand, however, logistically, if children are coming in 3 days a week, 1 week for in-person learning, and 2 days the following week, it would involve one additional remote day for students every other week. We would also want some feedback on it from our parents, because we didn't want to further complicate childcare arrangements for our parents of our youngest students. I'm going to ask Mr. McHugh to talk a little bit about virtual Wednesdays a little bit and some of the steps that we did take to look at this option and other options to try to increase in-person learning for the elementary schools. Mr. McHugh, our Assistant Superintendent for Curriculum.
Our K-5 population's always been a priority. We put a lot of thought and a lot of planning into what this year would look like when we opened up. We really were cognizant of the fact of what was developmentally appropriate for children. We always realized that, you know, for our youngest learners, they're really adult dependent. So even when they're home and it's a live virtual day, without that adult support, that live virtual Wednesday is a challenge for our students. At the same time, we also discussed the fact that at any point with this COVID-19 pandemic, we could be forced to go to a full remote. There's districts that have been forced to go full remote K-5. There are some districts that haven't had 1 day of in-person learning yet. So we looked at every day that we actually had students in front of our teachers as a gift. We expanded our one-to-one initiative to get the tablets for our youngest learners. That took some instruction as well. It's been incorporated into our in-person days. Our teachers are using those devices to enhance teaching and learning. We also have integrated some new platforms to try to make that transition virtual instruction a little easier for our students. An example of that would be Seesaw. But just like what Mr. Simons mentioned, if we did alternate Wednesdays and gave, 1 week A students would have 3 days of in-person, the B students would have 2, and then vice versa the following week, you're looking at in a 2-week period that students would have 5 days of direct instruction from teachers compared to what they have right now, which would be 6 days of in-person, or 6 days of direct instruction with a teacher, 2 of those days each week being in person, the other one being virtual. So there are some mixed opinions out there. We've surveyed parents and some like the virtual Wednesdays. There's a lot of anxiety right now about kids coming to school. And, just at the same time that we've had parents that want more, we've had other families and parents that if you add any more or change that hybrid, we would want to go full remote. So we are working on getting more proficient at it. Our teachers are exhausted at the end of the day, delivering that live virtual instruction. So definitely a challenge for everyone, but we're well aware of the challenges involved.
Thank you, Mr. McHugh. Mr. Adam, let's go to another question.
Ensuring that both A and B day students have equal in-person days. And perhaps they're alluding to the fact of school closings that we've had and holidays throughout the year.
We indicated when we announced the reopening plan that we would continually evaluate the impact of the calendar on students to try to be as equitable as possible regarding the number of in-person days, whether you're in an A group or a B group. Our initial analysis indicated that it was only about a 1.5 day difference, and I'll ask Mr. McHugh to clarify that. And we don't know the full impact of the weather and how that will affect the schedule. We do pledge to adjust it if necessary. We did adjust it as a result of the power outage that occurred on October 7th. We made a change to the schedule to shift so that additional day of in-person learning could be provided to the group that was impacted on those days, and we're committed to doing that. We're continually evaluating this every day. The value of in-person learning days is important to the district. We want to make sure that we can be as fair and equitable as possible. Mr. Adam?
All right, next question. If cases continue to rise, will you continue to prioritize in-person for K-5?
The answer to that is yes. We've indicated in our slides this evening that in the event that the circumstances of the case increases result in us not being able to do K-12 in person under the current hybrid, we would make an adjustment that would shift the middle school and the high school, hopefully for a very short period, to virtual learning. And that would enable us to use what available substitutes, both instructional and non-instructional staff we have to focus on the elementary school in person. I'll ask Ms. Cannon to talk a little bit about how the substitute process works and what we're seeing in employee trends. But we do want to make sure that if we are in a situation after the holidays that forces us to implement a different model, that we do everything possible to make sure that the current hybrid for the kindergarten through 5th grade kids could be maintained by our staffing. Ms. Cannon?
So we've made a lot of strides to increase our substitute pool, both on the instructional side and the non-instructional side. Over the last 2 years, we've brought in an additional 80 substitute teachers, and we are continuously recruiting. At our last board meeting, we welcomed on 3 new substitute teachers, and I have conducted over 10 interviews between last week and this week to bring on additional substitute teachers. One of the areas, though, that we are hurting on is the substitute drivers, because every time we have a case, we are not only quarantining the students on the school bus, but we're taking the entire bus, which takes our drivers. So when our contractual full-time drivers are quarantined for up to the 14 days, we then have to put in a substitute driver during that 14-day window, which further erodes our ability to have a complete staffing in the transportation department. So we are right now seeing the trend of, unfortunately, we do have to quarantine the entire bus at this time, and that's causing us to take some pause to see daily, do we have enough drivers? And I'm working with Mr. Noeth to make sure each and every day we do have that. And if there was ever a time when we did not, we would certainly take a harder look at that. Most recently, we've just put an ad in the Times Union for additional substitute drivers, and that ad is going to run this upcoming Sunday and the following Thursday.
Thank you, Ms. Cannon.
All right. My biggest concern is the discrepancy in the quality of work for remote days. 3 worksheets is not comparable to a full day of school.
What I would say is, if you have a concern as a parent regarding the quality of work that your children are receiving on a remote day, you should contact the teacher directly. And if the issue is unable to be addressed to your satisfaction, you would want to talk to the building principal. The building principals, including those that are here with me, have really facilitated some solutions to some of these issues that come up with remote learning. I'd have to say that if it is the case that 3 worksheets is being provided on a remote learning day, that it would probably be the exception rather than the rule, if in case that is happening. I know that at our elementary school level, if this is what it's referring to, they really have done a very good job of keeping the kids engaged in meaningful work, including on the remote snow day of last week. Many teachers shared with us the samples of things that they were doing to try to make sure that the students were engaged. So I'll ask Mr. Alvey, who has been really involved in resolving issues for our families, talk a little bit about how that process works and what you can do in the event that you have a concern about what's happening. Mr. Alvey, who is the principal at Donald P. Sutherland School.
Thank you, Mr. Simons, and you really said it well. The first step is to reach out to your child's teacher and communicate with them. Share with them your concerns and engage in the dialogue. I'm finding these days a phone call goes a lot further than we're getting used to the emails and the back and forth. And I know that that's sometimes the easiest way, but sometimes a phone call also helps clarify. So I would say reach out by whatever means possible, to get that resolved. And then, like Mr. Simon said, if there's still a concern, please reach out to us as building principals. We're there to provide support. We want what's in the best interest of the kids, and we'll work through it with both staff and families.
Thank you, Mr. Alvey. I made an assumption that question and concern was related to elementary. I don't know that it was. One thing I will say as both an educator and a parent, if at the middle school level and the high school level, there are different circumstances. There are situations that we have found where we are made aware of a concern about the level of work or the amount of work, whether it be too little, too much, and we've been able to address it. In some cases, in addressing it, we have found out that perhaps the communication at home could have been better between the student and the parent. We all have middle school and high school kids who we want to make sure are engaged on remote learning days. So it's very important on a daily basis, and I'm not assuming this isn't happening, but it's very important on a daily basis for parents to talk with their kids, not only about whether or not they have remote work to complete, but what do they have to do and what are they learning in their remote work, to really engage the students in a conversation so we have a full breadth of understanding of what the kids are expected to do and what they're learning. And that becomes more difficult as the kids get older in middle school and high school, but it's really important to have those conversations so that you are both understanding what the students have to do, but also helping to set those expectations at home.
Mr. Simons, I just want to add one more thing that, at the beginning of the year, through our open house, all of our teachers at the elementary level really laid out what their plans were for the remote instruction days and what those asynchronous days look like, where we don't have the direct instruction. Much of it is work that's reinforced from the previous day with their live in-person instruction. So there may be worksheets involved, but that should be the exception, not the rule. So just wanted to.
Thank you. Mr. Adam?
Next question. My concern is that we are one of the only districts in this area who has K-5 on a hybrid model. How can you say our kids won't fall behind?
Well, I've never said the kids won't fall behind. Kids are falling behind across the country. And it is in part because school districts are not able to have kids 5 days a week, K through 12, and offer in-person learning and adhere to the social distance requirements within the space. Our district is assessing on a regular basis the impact of the COVID-19 on our students and our students' growth and our students' performance. However, we do recognize that in some cases there are kids that are falling behind, and we have engaged in a process where we are identifying the kids that we feel at this point are not engaging on remote days and seeing what we can do to prioritize those students and bring them in for in-person learning after this most recent increase in infection rates gets behind us. For example, at the middle school level, we have brought some of our alternative students and some of our students who have IEPs in for more in-person learning, and we have considered that and done that for the high school as well. The board is anticipating on January 13th that we'll present some proposals, including what we might do to close the gap for some of our K-5 students who are being impacted by the hybrid. I wish that we could simply open up our doors and we could provide in-person learning for every student, kindergarten through 5th grade, and really for every student, kindergarten through 12th grade. We have preserved some of the services for the kids in order to be able to make sure that that gap is not as wide as it otherwise would be. Our academic intervention services, our related services, and our other services such as speech, occupational therapy, and special education to make sure that we are aware of students that are struggling and can intervene. And we're offering those services in person to the students as best we can.
Next question. Would you offer parents and caregivers the option to drive kids to school if it meant they could have in-person learning if there aren't enough drivers?
We actually entertained that scenario and talked about that scenario really around just around the Thanksgiving weekend. You may recall that we had a bus driver within our district who we received notice on a Saturday evening regarding an infection that affected 3 buses, one at the elementary run at Green Meadow, one at Goff Middle School, and one at the high school. And during that review, we talked about what we might be able to do in the event that we didn't have sufficient drivers. We haven't made a determination on that yet. One of the concerns would be, how do we know that there's equity involved? How do we provide busing for those students that need it the most? When we did a survey back in the summer, we found that many families indicated that they were going to need busing, but yet the ridership on the buses as we opened up in September did not match the number of parents that indicated. So in order to do that, I would love to do that, to be able to make sure that the schools were still open, as long as we could have accurate information to know what kids really needed a bus and what parents could actually drive their children to school. And that is still an option that is under consideration.
Where do teachers and staff fall in line on getting the vaccine?
At this point, I have not been informed by Rensselaer County Department of Health or the New York State Department of Health that there has been any prioritization of school personnel, other than something I briefly heard in the car on my way back here on the radio today. I did hear that as part of the new federal package that has been that is supposed to be approved this evening, or maybe it already has, I've been here most of the day, that there is some funding for schools included that will be allocated by Congress. And then some of that funding would identify certain categories of employees as being in a tier for prioritization for the vaccine. I briefly heard it on the radio. I need to research it a little bit more. We would likely receive both federal and state guidance from that. I'm going to tip this one over to Craig Hansen, because he's really in the loop, and if he knows it, he can share it with us if he's heard something similar. Craig, have you heard anything about prioritizing school personnel for the vaccine?
I have not yet, Mr. Simons. And part of our concern is making sure that the school nurses are in that priority list as well. So we've raised that question up through state health, through our county partners, but we'll add it for a topic of discussion on Wednesday to make sure, to see what the county knows, to see if they know their priority, but I have not heard that.
Dr. Albo, do you want to give some general comments about the vaccine itself? Because we do have an audience of more than 100 people here, and we've heard a lot about the vaccine. We've heard the good news announcements over the course of the last few weeks, but we've also heard some trepidation on the part of community members and residents of our state regarding the safety of the vaccine. Can you talk a little bit about that since we have the opportunity?
Sure. In answer to just briefly the original question, and just to touch on my limited knowledge of that, the school staff would be considered essential workers and so would be offered the vaccine ahead of other people as essential workers. But I'm not aware of anything beyond them getting it at the top of the line of essential workers. As far as the vaccine's concerned, the first ones to come out are they have special storage requirements, and so it's difficult to get them to places and to be stored for any significant amount of time, and they have to be given out very quickly in large amounts across very many people. So it's easy to be given to a lot of people in a hospital, for example, but the general population, it's not really at a point where it can be given out to, essential workers that aren't linked to some much larger institution with a lot of capability. The vaccine has been fairly well studied and is, while all vaccines have some degree of risk with them, the risk of the vaccine is very, very small compared to the risk of coronavirus. So I've become aware of a few reactions that have heard have occurred, but the risk of coronavirus far outweighs the risk of the vaccine to generally to most people. I would say, while we're talking at a school meeting, it's not clear exactly when children would be getting it, and it needs to be delineated exactly what age, down to what age they'd be giving it, and so that's a whole different question. Does that help?
Yes, thank you, Dr. Albert.
All right, let's do one more question in this thought exchange, and then we can move on to the next one. What if a parent refuses to have their child tested if we go to a yellow zone?
We need volunteers. It's not something that is required at this point. And we would anticipate that we would be able to get 20% of our parents to consent. It only has to occur over a 2-week period under a yellow zone. So once we've tested 20% of our children and our employees, if the infection rate within our sample is less than the cluster, which is the microcluster or the geographic region, we can continue to have our schools open for in-person learning. We would encourage parents to consent. No student would be denied under the current regulations attendance for in-person learning, as long as we get to 20%. So we would not be mandating or requiring this of students, but we would encourage families to consent so that we can get an adequate pool and comply with the regulations to stay open.
All right. Bear with me as I move to the next thought exchange.
As Mr. Adam is moving to the next thought exchange, I know we were not able to address everyone's questions, but as we did in the spring and in the fall, we are capturing these questions, are we not, Mr. Adam? And we will be able to put out an FAQ within the next few days to respond to the questions that we were unable to answer. Is that right?
We are.
Okay.
Yes.
So please check the website and we will send you an announcement when all of the questions and responses have been posted.
All right, I'm gonna reshare my screen. Okay, here's the next thought exchange. Again, go to tejoin.com and then type in the 9-digit code that you see on your screen. And the question is, what are your thoughts, questions, and concerns about the health and safety measures we have implemented this fall? And I'll leave this screen up for a minute so you can log in. And again, type in your question or your concern, and then at the next stage, you can rank the questions and thoughts of others. Just about a minute left, so get your questions in, and then we'll bring your questions to the panel. All right, you can continue to interact with the thought exchange by adding your questions and rating the questions of others. First one, I think in terms of health and safety, you are doing a great job. Thank you for keeping our students safe.
I appreciate that comment very much. It's been very important to our board, and Mr. Buno is representing the board this evening, and our administrative staff and our entire faculty and staff to implement the safest model we could. So that comment really is very much appreciated. I want to use this opportunity, since most of the comments are positive, and I will address some questions, to get Karen Vincent, our COVID coordinator, involved in the discussion, as well as Craig Hansen from his perspective, because he gets to see what all districts are doing. So I'm going to ask Karen very briefly to talk a little bit about what goes on when we get a notification from a parent or from the Department of Health, from your perspective regarding how we make sure that we have every student and every staff member who potentially came into contact with the case identified and communicated with so that we continue to have a safe environment. Karen, you want to give us a little report from the ground up, so to speak?
Sure. Like you said before, when we get notification, we pull all the seating charts, if they took the bus, the seating charts for the bus, the lunches, the specials, every class. In high school, as you said, they all change. We get together with the teachers, interview them, see what kind of day they had. Were they moving around? Were the students talking a lot? Did the teachers stay in the front of the class more? Were the children reading more? All these things that would help the virus or help the particles stay in the air longer or not. We just like to know who was around each case. And sometimes it's less than 10 minutes depending on that kind of contact. But we make a list and we go most of the time, all the time to the extent of the health department, but most of the time past that extent, just with the student safety in mind. We then contact we compare that list with all of the guidelines by the Department of Health, verify it all with them. And then we contact every parent by phone. And once that is done, then we will send out the notice to the district. And we also send out emails with information from the Department of Health, as well as a welcoming letter, if you will, to the district's handling of the quarantine. I kind of put my information out there as a go-to and let them know how we plan on screening, how we do the screening of symptoms. That's done daily, and then any signs or symptoms are reported to the Department of Health.
I would say our students and our parents have done a really good job, and our employees, of doing that screening on a daily basis. We have almost 100% every day of people doing that. And our nurses on the front lines have really done a good job of responding to students and employees who may be indicating symptoms of potential COVID-19 in the school. So I think everybody's done a really good job in both the contact tracing and in the screening for symptoms. One thing I would ask Craig Hansen, who is from Questar again, as we start to strive to keep our schools open, can you share a little bit about what is involved from make the reporting end of the testing? If we have to do the testing, logistically, I think it might be helpful for people to understand what are we going to do with those test results?
Well, part of the limited service laboratory award and certification that we got to provide this for our schools is collecting that data. We need to report all of the both the positive and the negative results. So all results get reported back into the eClear system, which is a state monitoring system for all communicable diseases. So we would have the data to collect from our school districts to enter into eClears. And then that's how that information is shared with the health departments. So as Karen alluded to, when there's a positive case that occurs in any school district, a lot of times the district is the first one to know about it before the health department, because it hasn't gone through those channels. It hasn't been uploaded into those systems for them to see. So preemptively, what we've done as well, working with all of our counties, is getting the counties to allow the schools to get in front of those items and those individuals that may be identified, so that they can prevent somebody who should not be in a school building, to not report. But taking that data from that testing, from the antigen testing, is also going to help the state recognize what's going on if we're in those yellow zones or the red zones or the orange zones, and help identify what the community spread looks like in those areas. And it's really about that data collection that reported back up to the state, and they'll be monitoring this for each zone, and it may elevate or de-escalate depending on the results.
Thank you, Craig. There's a question on here that popped up that I just saw that I want to ask you to answer, because you clarified this for us the other day as a group of superintendents. There's questions regarding the testing groups, and if one school's infection rate as a result of testing perhaps was higher than another's. What, can you clarify what the requirement is, the 20%? Because it's broader than people may have first interpreted.
Sure. So the 20% for the yellow zones is 20% of both staff and students. So if you break it down by per building, and again, the data is reported based on the school reporting dashboard, and it's each identified per location, per building. So a district as large as East Greenbush, covering multiple towns, the zone designations in the microclusters may be associated with certain localities and not necessarily the whole county. So it could be a potential where the town of East Greenbush could be in that, but yet the town of Nassau or the NLP Sutherland is not. So that's why it's important to identify as we tell schools to look at their testing plans and that planning process to identify each building and to identify, what is that 20%? If you break it down, 20% of staff and students, realistically, you could be looking at 10% students, 10% staff to meet that 20%.
Thank you, Craig. Mr. Adam?
Next question. If the district is forced to move to full remote on January 4th, can you discuss how and how often the district will reevaluate the reopening and its criteria?
I think the initial decision over the holidays is going to be a tough one to make, to be honest with you. And as I have been meeting with the faculty and staff, I've been explaining that it's really a weighing of the educational considerations to continue to offer in-person learning. Do we have the staff to do it safely and to do it with quality, versus on the other end of the scale is the infection rate, the number of employees and number of students who've been impacted over the holidays, likely to tip the scales that it seems like virtual learning would be the best option as we continue to monitor the impact of COVID-19 infection rates over the holidays. So that initial decision is going to be incumbent upon families and staff to communicate with the district. We are reachable over the holidays through an email, and we want to know what's happening. We want to know what's happening with students who may get positive test results, families that may have questions regarding symptomatic students, and we want to know from our employees what's happening so that we can make the best decision possible in anticipation of January 4th. If that information leads us to believe that we're going to have trouble on Monday, January 4th, opening up at a certain level, we would make the determination at that time to prioritize the K-5, to use our available subpool to open up K-5 and shift the middle school and the high school to virtual, to see, to know that the assurances that we can open the elementary schools with appropriate staff would work. Then we have to decide when we reopen. Okay, and that is going to be a continuing monitoring of the list of people that work for the district who are quarantined, the availability of the person to become, the dates at which the people would no longer be quarantined and come back into the school, and a continuing monitoring of the infection rate, the 7-day rolling average, and what might be happening as a predictor of future issues that we might experience in the district. So there's no exact mathematical formula that we can use in this degree of uncertainty, but we would be weighing various factors in prioritizing the elementary school.
And Mr. Simons, just to follow up on that, I know you mentioned it in your presentation, but let's say a student has some congestion or a headache or some other COVID symptoms over the break. what should the parent be doing to inform us?
Well, I think the first thing the parent should do regarding any symptoms that may be related to COVID-19 is to call their primary care provider, okay, and have the primary care provider do an evaluation of an assessment. Students are not supposed to attend in-person learning if they're indicating any one of the symptoms listed under the CDC and New York State Department of Health guidelines. So first thing to do is to contact your physician. Now, we had an example the other day where we learned of a case of a student who was positive at the middle school level. We did not have to do any contact tracing, nor did we have to quarantine anybody within the school, because the parent's first reaction to the child having a headache was the right response. She kept the child home from school. Even though he just had a headache, she contacted the primary care provider and she had the child tested. Now, that test result shows up many days later. And with the increased cases, it could show up, it could be a 15-minute test that shows up within a couple of hours, or as the cases increase, it could be a few days. But she kept the child home from school, referred the issue to her child's pediatrician, and we didn't have to do anything that impacted the school. So I would say it's advisable to contact your primary care provider first. I would also say go get a test if necessary. You could go on our website, on our homepage, and in the yellow band at the top of the page are testing sites that are available within our region. In some cases, it is easier than others, quite honestly, to get in to get a test. It is not as easy as perhaps is often announced. And if you need some guidance and direction regarding how to go about responding to this, you can either contact my office through an email, and I will forward it to somebody, possibly Karen or somebody who is available to help provide you with some guidance of how to deal with it. But we want to know what's going on with our children and our families and our employees over the holidays, so we can be as proactive as possible and we can plan.
Mr. Simons, we're coming up on 8:30, but we still have about 100 people watching. Can we jump to a final thought exchange and go
Yep.
over a bit?
That'd be great. If we would encourage as many people to stay on as possible. I want to get more of our panel in too, so I'm hoping that we can have some time for some more questions to see if we can get other people involved in the conversation.
I do just want to read off a couple comments because kudos are deserved for our health and safety protocols. You've done a great job. Thank you to staff, teachers, and principals. Health and safety has been great. You have done an amazing job in this regard. I think you've been doing a thorough job and communicated effectively and as efficiently as possible. And while I move to the next thought exchange, I just want to leave you with maybe a topic to discuss with Dr. Albert. Are you planning on a hybrid model for fall 2021, since the vaccines aren't approved for children? Pfizer is for 16 and older, Moderna is for 18 and older.
I think that's an excellent question. As I said to the faculty and staff, at this point, based on the information I have available, I don't really know what might happen within the next hour, to be quite honest with you, about COVID-19 and the cases that we might be impacted by. Our preference would be to open up in the fall if the situation presents itself and the state relaxes some of the health standards because they can, due to the infection being under control. Nothing would make me happier and nothing would make all of you happier if we could have 5 days of instruction in person for everybody. That's what we want. In the event that our health community, Department of Health, advises us that there's some kind of a phase-in that needs to occur in order to ensure that vaccines are available for kids, we certainly would adhere to that guidance. Dr. Albert, do you have any comments on this? The fact that the vaccines that are available right now are only tested on 16-year-olds and up?
Yeah, it's along the lines of what I was trying to say earlier, but I can reflect what you said in different words. There's too many factors at play to make any kind of a judgment about, next fall. There's some hope that the studies that are being done now will supply enough evidence to support safety and efficacy for many school-age children, and that by the time summer rolls around, the number of school-age students who are immunized and adults who are immunized are sufficient enough to suppress the community spread of the virus. But there's lots of other factors, like the potential virus coming out of Europe that may be able to spread faster, as well as how many people actually want to get the vaccine if only half the population wants to get it. It may not be enough, or it may be enough, but there's a lot that is still left to be said. Another part of the equation is that, fortunately, children tend not to have severe disease from the COVID virus, so that may play a role as well.
Great. Thank you, Dr. Albert.
All right, so this is our final thought exchange of the night. Again, go to tejoin.com and then type in the 9-digit code that you see on your screen. The question will be preempted by 2 survey questions. Just one, what is your role in the district, whether that's a parent or a student or staff member? And then the second survey question. And then once you do those, you can submit your question or your concern, and then move on to the next phase and rank the thoughts of others. And the question is, should our region experience a surge of cases after the holidays, which requires our schools to remain in virtual instruction? What are your primary questions or concerns? Again, you'll visit tejoin.com, type in the 9-digit code on your screen. You'll answer 2 quick survey questions, and then you can submit your thought. And please continue to interact with the thought exchange. We'll get started with answering the preliminary questions that we see here. And first up, please offer parents the option to drive kids in if that is a determining factor.
We will definitely be considering that and looking at the feasibility of that. Yes, I am aware that that could be an option, and we just need to make sure that, as I said earlier, that that all students can get to school somehow. And it could be a combination of parents driving their children who are able to, and some modified bus routes to ensure that kids who are unable to get here due to either a parent's early work schedule or to a lack of reliable transportation, we need to make sure that we consider those factors in such a plan. But yes, that is something that I have given some thought to and would continue to do so in the event that we are short of bus drivers.
Next comment is, keep younger kids on AB schedule with remote days. 5 days of virtual learning would be too much.
One of the things we would probably have to do to really be able to address this concern is to, do some surveying to see whether or not that's the feeling of everybody. I do think the intent is to keep the hybrid as is for the K-5 and to shift the virtual learning to the middle school and high school so that we don't have to have virtual learning 5 days in a row for our youngest children. We did this as a short-term measure to get through the holidays, and it really did change one day of the schedule for each group of students, A and B.
The younger children require a lot of hands-on, which can be disruptive to parents who work from home, need to maintain employment to provide for family.
We are very concerned about this. We are very aware that in some cases, particularly our youngest children, need assistance at home. There's only so much that we can do in the situation. We can help you identify a resource to be able to provide that support in the event that you have to go to work. We can work with the various agencies that provide childcare to see if families qualify for financial assistance. I will say that our elementary teachers are going above and beyond in most cases to help families in these situations. They are also doing extra things in order to facilitate learning for students who may be being voluntarily kept out of school by parents, which is something that we have to, at some point as we get through the holidays, specify that the options for the district are full remote or hybrid right now. And so we're going to be reestablishing some of the parameters to participate in those two options. But we'll do everything we can within our resources to help families in these situations. We are not insensitive to the fact that families have to go to work and that our youngest children, in some cases, are not able to be independent to complete that work. And those are issues that also need to be communicated directly from parents to the teachers. And in the event that the teacher isn't able to solve the problem, to our principal, who can intervene and see what they can do to make the situation better. The other thing I would say is the large majority of districts in our state and in our country have some level of hybrid learning going on. And as the cases go up, more districts are going to be shifting to virtual. There was an article in the Times Union today about the number of districts that within the last 2 weeks have shifted to virtual or remote learning. And we're going to do our best to try to respond to family circumstances.
All right, next one. Socially and emotionally, how can students remain connected to peers, teachers, and others that they interact with while in-person instruction?
Okay, I know that there are some really great things going on in our elementary schools that provide examples of this. And this is a good opportunity for me to get Mr. Garib from Green Meadow in here. There are lots of ways that our kids are engaging in fun ways at the kindergarten through 5th grade level with our teachers. So Mr. Garib, you shared with me a couple of those just within the last few days.
Sure, thank you, Mr. Simons. There's actually been quite a few things, not just happening here at Green Meadow, but in, I believe, most of the elementary schools. The teachers are really trying to engage the kids in a fun and meaningful way. Most recently, here at Green Meadow, we sponsored a live virtual assembly with a guest speaker, uncharted territory, which involved exotic animals. And what was really nice about it was an opportunity for full remote students, which come across from district-wide, multiple schools, as well as our in-person students, to both experience the same assembly at the same time and interact and ask questions. The other thing that's going on to really try to create some fun things, I actually just got up to get it. Our 2nd grade has been working on a STEM project, and they had this plan for this upcoming virtual Wednesday, and the teachers were concerned that the A-Day students did not get the supplies. So they offered a pack and pickup, but they're really trying to make, we've got the teacher's packet here, trying to do hands-on fun activities, even on the virtual days. And those are opportunities where students in A group and B group can work, with each other. And then we also try to tie in our full remote students as well. So there's a lot of different things going on. We realize it's not the same as being here 5 days a week in person, but we're certainly giving it our best shot to make it as meaningful, fun, and educational as possible.
Thank you, Mr. Garb. Mr. Adam?
Let's see. I'd like to see my elementary age children follow a schedule more closely aligned to their in-person schedule to get more instruction.
I'm going to ask Mr. McHugh to offer some comments on this. In general, I would say when the elementary teachers got together in the summer to plan the experiences of both virtual Wednesday and remote learning, they were very sensitive to the perception that kids would be on the screen all day and be overwhelmed by the experience. So they provided a schedule that provides for large Google Meets as well as individual and small group instruction, some downtime for the kids, and recognizing that the typical 6.5 to 7 hour instructional day could not be completely replicated via either virtual or remote instruction. The types of activities that they are doing on the remote days are being supported with direct instruction when the students are in the classroom on their in-person days. Mr. McHugh, anything to add?
Yeah, I mean, we spent a lot of time really with a group of teachers. We've had probably about 18 teachers really working on a plan this summer. But we wanted to make sure that there was some flexibility in there, what's developmentally appropriate. So it's really not reasonable to think that a student's going to log on to the computer at the age of 5 or 6 and at 9 o'clock in the morning, they're going to stay engaged until 3:30 in the afternoon. That's unreasonable. When we talk about what's developmentally appropriate, the attention span is equivalent to about 1 minute per chronic age of a child. So with a 5-year-old, you've really got 5 minutes of that real focused attention. So our K2 plan and our 3 through 5 plan are very similar. There's a core content block in the morning. That core content block is approximately 120 minutes, but we define what that core content block is. And that's live instruction, including whole and small groups. So the teacher could log on for that core content block as a whole group, give some instruction. There could be time where the students are actually engaged in work and then they're checking back with the teacher during that core content block. There could be small group, but also related services could be provided. And then there's a 70-minute core content block in the afternoon. So, you're talking about 3 hours of direct instruction, whether it's whole group or small group, which, we feel is developmentally appropriate. But again, our teachers have control over that, right? Every class is a little unique. Every year, your class makeup is a little different. So our teachers are the professionals that describe how to use those core content blocks appropriately to deliver instruction.
Thank you, Mr. McHugh. One thing I want to say, and I don't intend to oversimplify the complexities of remote learning or the environment at home and the challenges of this for our families. But one of the things that you can do as a parent that you don't need to be a teacher to do is have your children reading. If there is there downtime in the schedule or opportunities throughout the day for students just to engage and read independently, that is one of the most valuable things that you can do, no matter what grade level, whether it be first grade through 5th grade. Students always need practice with their math facts. That's something that a teacher does. You don't need a teacher to do that, to practice addition, subtraction, multiplication, and division. Find ways for your students your children to engage in meaningful writing and meaningful sharing of the stories that they're reading. Anything to keep the children developing their literacy skills and their mathematics skills, in addition to what the teachers are providing, will go a long way to make sure that they continue to grow.
All right, how about a couple more questions, Mr. Simons?
Sure.
If there is a surge, could the district implement rapid testing options so that students testing negative can still attend in person?
Well, under the yellow zone, red zone, and orange zone, those are the requirements. The test that we're doing is an antigen test. It is a rapid test, and it is intended to ensure that we can stay open. Obviously, the students who test positive would be isolated and have to quarantine. But this is the testing option that is available from New York State Department of Health that the Questar will be helping us to coordinate. Craig, anything additional? It is a rapid test, is it not?
Yes, it is. It's a rapid test. So we would, again, under our umbrella of the LSL for all of our districts within our BOCES, we didn't secure and procure those tests for the districts so that you could stay open. That's the whole intent with that rapid test.
Thank you, Craig.
While I understand this is a possibility, I would hope the priority would be in returning to in-person as quickly as possible in a safe manner.
That is the priority. That has always been the priority. That's been the priority since March 13th of the spring, in which we were impacted by COVID-19. We all want to work with our families, our students, and our staff to preserve and provide as much in-person learning in our classrooms with our teachers and with students with their peers as we get through this. And I would hope, given what we've known so far across the state, that we will be in a better position as we move towards the spring to be able to make some adjustments to accomplish that.
Next one, I wish the school district decides on a school-by-school basis. One school should not affect another school when it comes to closing because of staff absences or virus spread. It's not fair to our children.
That's really difficult to do when you share a pool of substitute teachers and non-instructional staff. We are one district. We would certainly be open to looking at options that might permit schools, depending on staffing, to remain open. The difficulty is, the same substitutes that go to Belltop generally are the same substitutes that go to DPS or Green Meadow, not in all cases, but they're employed by the school district and we provide them on a need basis. The factors that influence that determination is how early we can know the impact of COVID-19 on our staff. And we don't, at this point, have any safe, fail-proof ways to know in advance. Going back to the decision and the announcement we made on Friday, we had a situation yesterday on a Sunday where we learned of 2 additional cases. We have a situation today where we're still learning about additional cases that may result in some quarantines. Now, yesterday's cases didn't involve quarantining students, but it is not beyond the realm of what we've experienced to find out on a Sunday afternoon or a Sunday evening that we have to contact trace because a bus driver became infected and was informed of a positive result over a weekend on a Sunday. The parents and the families would have been under greater stress if I had informed you on Sunday night that the elementary schools, the middle schools were shifting to full virtual with only less than 24 hours notice. So we made a calculation based on what we knew at the time on Friday and the likelihood that our staff absences could go to a point where we wouldn't be able to open on Monday. And so we made the determination, as difficult as it was, to inform you on Friday rather than wait to see what happens and potentially further impact our families. Doing it on a school by school basis would be very, very difficult.
All right, last question, comment rather. Elementary students need to take priority, especially because the COVID positive rates are so much lower in the elementary schools.
I think that still tends to be true, that the positive results are lower at the elementary school level. However, we have seen since Halloween and into Thanksgiving, if you may recall, there was a period of time in the late fall where we hadn't had any elementary cases. Now we've had a number of elementary cases as a result of some of the exposures that have occurred over the holidays. And while it is the case that we've had fewer elementary students either positive or affected through a quarantine, and we have indicated that in the event that we do have to consider going virtual, we will prioritize the elementary kids. But in doing so, we also have looked at the impact of both academics and the mental health considerations and emotional well-being of all of our kids, both at the middle school and the high school. And we came to a conclusion under ordinary circumstances with the monitoring of the COVID-19 situation, we should strive as much as possible to have some level of in-person learning for all the kids, elementary, middle school, and high school. As we get into a situation that may be short-term, we will prioritize the elementary situation as we're now dealing with the impact of staff shortages and have to spread our staff over our 7 buildings right now. We may have to adjust to spread what substitutes we have available just to the elementary level. In closing, I want to give an opportunity for our board president, who's been here, and Mike's been patiently listening to this discussion, to offer some comments, and then I will ask anybody on the panel, maybe some of you who haven't had an opportunity to comment, to share some comments, and then we'll wrap up. I think the community needs to understand that the situation is very fluid, and the board has expected from me continued communication to the board and to the community regarding this situation. And we're proud of the fact that we have a volunteer board of education who is continuing to look at the whole of everything that's going on and trying to work with our administration and our community to do the best we can under extraordinarily difficult circumstances. So I'm going to ask Mr. Buno if he wants to offer any comments from the board's perspective.
Sure, Chair. Thanks. First, I want to thank everyone for participating and attending. Excuse me. And really, the amount of work that's going into keeping our children and our families safe, our staff safe since March, to develop a plan that provides an effective instructional model for our students, keeps our staff and families safe. That's been our priority. And this impacts everyone. You know, I'm a parent in the district, lived in the community for many, many years. And this is unprecedented for us to have to deal with as a district and as a community. And we see the impact on our families, our businesses. And I think at this time, you know, we're trying to meet the challenges as best we can for the 4,000 plus students in our district, K-12, the special needs, those students who are at risk, some of our most vulnerable children, and really make sure that we provide the best opportunities for an educational program in a safe and efficient way for everyone so they can get through this pandemic together. And the board is always thinking about the safety and health of our kids and our families and our staff. And I just commend them for the amount of work that they've done to prepare for this moment. We don't want to be here. We want to be with you. We want to be with our kids. We're missing a lot. We just want you to understand that our board, our administration, our teachers are doing the very best they can. Our parents are doing a wonderful job under extremely difficult circumstances. And just stay with us, be patient. We're in it for the long haul, for our kids and for our families and for our community. And that's what we have to remember. This is a long-term issue we've been dealing with since almost a year ago. And we'll get through this. We'll be better for it. We hear your concerns. We understand the elementary issues. And in the end, our kids will be stronger, and we'll make the commitment to make sure we address those gaps. And if you've been listening to some of our board meetings, you can see that that is a huge concern for this district of our students being able to stay current, to meet the needs and address those gaps that are occurring and get back on track so we can be ready to go. And I want us to be open in the fall, full time. And, you know, we can't control the COVID. We're doing the best we can to do those things and mitigate it. But in the end, you know, we'll do what's best for our families to keep them safe, for our staff to stay safe, and to really make sure that this district can get back to where it's one of the best districts in the region. And our goal is to keep it that way. So thank you for everyone who participated, and I appreciate your support.
Thank you, Mr. Buno. Are there any closing comments from anybody on the panel who we didn't call on? No obligations, but I know we primarily focused on responding to the questions. Ms. McGrath is our Director of PPS. Molly?
Yes, Mr. Simons. I would just like to take a moment to thank the families that have been on the receiving end of a phone call informing them that their child is a proximate contact and they'll have to quarantine. Families have been extremely understanding and flexible when they receive that information, and they continue to be our partners in keeping our schools safe. So I just really wanted to thank those families.
Thank you, Molly. Anyone else?
Jeff, I would be remiss if I didn't thank our building and grounds and custodial staff and for all the extra work that they do to keep our buildings and our grounds safe. The amount of work that they've done to address areas where there have been cases, and our nurses and all the folks who were kind of behind the scenes making things happen. They're really the strength of our district as well, and I want to thank them.
I really appreciate that, Mike. As Mike said, the district is in a very unique situation, a difficult situation as we continue to assess what's happening with COVID-19. And I would just reiterate, first and foremost, I want to wish everybody a very happy and safe holiday season, whether you celebrate in a different way than you normally do, whether it's Christmas or Hanukkah or Kwanzaa, whether we're limited in the way that we can celebrate so that we can do it safely. But I do wish everybody in our community a really safe and happy, restful holiday as we approach. We will, again, communicate with you by December 30th if we're going to make any changes come January 4th. And we ask you to communicate with us if COVID-19 or the circumstances around COVID-19 are impacting your family in any way that the district may need to know about. Okay, and we provided the email addresses for you to do that. This is a really difficult thing, and it's been hard on our families. It's been hard on the district. And I think it's important to remember that there's a lot of good happening for our students, and that will continue to happen. And we all need to be as resourceful as possible to try to support the students and to be as positive as we can be, not necessarily to ignore the issues of concern that you have. We know you have issues of concern. We are trying to prioritize those to see what can be done safely within the district. I so much appreciate everybody participating on this panel with me to hear the questions and concerns. And I really do appreciate those of you who chose to attend this meeting this afternoon and this evening. We will continue to keep you informed. We appreciate all that you're doing to support your children at home and when they are in school. And we hope that as we move through this, we're looking at the other side of COVID-19. And as everyone has said, we look forward to the situation to improve as we move into the spring in service to the children. So thank you all for being with us this evening. Again, have a happy holiday season, and we will be communicating soon. And thank you very much.